There's a massive challenge with the NHS because more of the same won't hack it. We hear lots of talk about prevention, but the money doesn't follow the rhetoric. And actually what we need to be spending our money on is really pucker health centre facilities and multidisciplinary.
In the library at Dartington, this time we got John Ashton. John is a former director of public health for North West England and much else besides. And John, as we enter this period now, perhaps the honeymoon period for Keir Starmer's Labour government, I know that you are very exercised about the future of the National Health Service. Just lay out the challenge that Keir Starmer and his cabinet face right now as you see it. There's a massive challenge with the NHS because more of the same won't hack it. We've got these huge demographic pressures coming of an ageing population, and the NHS is already on its knees. We need a radical change of direction. What does that mean? It means we've got to stop the infatuation with hospitals, and we've got to invest as and when we can in prevention, in very strong primary care and social care, and also rediscovering the link between health and housing. Because if we get the right in housing investment, and there's a lot of housing investment proposed, then elderly people will be able to stay independently living in their communities for longer and not finish up in a care home, not finish up with several admissions to hospital in their last 12 months of life. So it's a radical change that's needed. Unfortunately, there's a huge collusion gone on traditionally between doctors, politicians and the public to think health is all about hospitals, and it's not. We've got to change the mindset. So talk me through that then. You talk about an infatuation with hospitals. What do you mean? Well, since the health service came into being in 1948, the proportion of money spent on health care has got sucked into the hospitals. Even since 2015, a larger and larger proportion of the NHS budget's gone into hospitals and less in general practice. Public health budgets have been shrunk in the last 10 years. So we hear lots of talk about prevention, but the money doesn't follow the rhetoric. And if we look at the differences in life expectancy, but also the period of time that ordinary working people live with long-term conditions and disabilities before they die early, there's huge scope for prevention. We're familiar with many of the factors, with still the smoking levels, which in the middle-class areas are as low as 5% or 8% of adult smoking. But if you go to industrial areas of the country, you'll find that still 50% or more of the adults will be smoking. You've got the smoking agenda, you've got the exercise agenda, you've got the junk food agenda, and the commercial determinants of health, which is increasingly what the World Health Organization is talking about, the drivers of ill health that are coming from uncontrolled commercial influences and marketing and all of that. And even down to, look what's happened with the gambling industry over the last 10 or 15 years, the way we've got 3 or 4 gambling-related suicides a week now of people in debt and taking their own lives with this marketing of gambling that's everywhere on the television, late-night programmes that young men watch. And we've really got to tackle all of this. So education is the key. It's clear to me, as you describe it, that this is going to be a long-term process. So in the short term, we are still going to need as many hospitals as we already have, aren't we, for the people who are going to get sick as a result of the systemic issues that you describe? Well, the immediate thing is that, Boris Johnson promised 40 hospitals. They still haven't built them. But if we do build them, the hospitals tie up the lion's share of the NHS budget. And actually what we need to be spending our money on is really pucker health centre facilities and multidisciplinary primary care, social care in the community. We could take a note from the Finns, where a health centre in Finland includes beds in the community where people can
be looked after by their GPs and by the community nurses and not go into hospital, or they can be discharged from hospital to that location and kept integrated in their community. If you go to Finland, you go to Sweden, you go to Denmark, you will see on the high street, along the way from a health centre, there will be sheltered accommodation where people can continue to live their lives as they become older and frail. The nurse can pop in from a health centre to keep an eye on people. And if people are suffering from dementia, they can go into a special care setting just further along the road, and again, where they can be still integrated. Denmark school children adopt a granny, come in from school on the way home and go and see elderly people. You know, what happens in this country so often, you've got these private care homes, not infrequently in the middle of the countryside, where nobody can go and see them, and they just get left there, were housed in the countryside.
So as I understand it, though, you're saying we need much greater education, much greater focus on primary care, much greater emphasis on people exercising, perhaps not just when they're young, but throughout their lives, staying mentally active as well, and resources from the NHS being diverted in that direction. It would take a very brave politician, though, wouldn't it, to say, never mind 40 new hospitals, we need fewer hospitals than we currently have. Is that part of your prescription?
This is the dilemma. What we need double running for 5, 10, 15 years while we shift from one model to another model. We had the opportunity with Sir Derek Wanless in 2002. You know, Sir Derek Wanless was asked by Gordon Brown to review the case for an increase in NHS funding from 6.5% to 8.5% more on the European model. And Sir Derek came back with the recommendation, yes, we could do that. It would be a good idea to increase it to 8.5% of GDP, but only if we had the so-called fully engaged scenario and invested the additional money in prevention and in primary care and public health. What happened was we gave a 30% pay rise to consultants and to GPs. I'm a medical consultant. I got a 30% pay rise after the Wanless report. I mean, now all the argy-bargy about medical pay, what's happening is that doctors are wanting to get back to the position they were in after they'd got the 30% for no increased productivity. And the money was also spent on the new hospital programme. It wasn't spent on the things that it needed to be spent on. So there's no money now.
And that double running that you described, John, is going to come at a price. So